I'm Dr. Robin Chatkan. Welcome to my weekly office hours live. Today we're going to be talking about diet for autoimmune disease, which is a topic that is very close and sort of dear to me. And just for a little bit of background, I'm a conventionally trained gastroenterologist. I did my medical training at Columbia for medical school, for internship, for residency, chief resident, 8 years there, and then 2 years at Mount Sinai for my GI fellowship. And Mount Sinai Hospital, for those of you who may not know, is where Dr. Burrell B. Crohn described Crohn's disease, one of the sort of prototypic autoimmune gut disorders. And he described that disease there at Mount Sinai in the 1930s, along with doctors Oppenheimer and Ginsburg, who are not really credited with the disease, but it was a gang of three. And so Mount Sinai, where I did my fellowship, has a really strong tradition of taking care of people with Crohn's disease and ulcerative colitis, which are two of the GI autoimmune diseases that I treat. And over the course of, the last decade and a half, I've gone from being an ardent prescriber of biologics, drugs that work for autoimmune diseases by suppressing the immune system, to being an unprescriber of these drugs. Why? Not because they don't work. They work very well in many cases, but because of the side effects, the toxicity, and the side effects being primarily infection, serious infection at times, and a potential risk of malignancy. And the other reason why is realizing over the years, through the help of many generous patients who allowed me to fiddle with their diet, that nutritional therapy can make a big difference for autoimmune disease. So before we really get into what that nutritional therapy looks like, let me just give you a little primer, a little refresher on what an autoimmune disease is. So without getting into too many details about the innate immune system and the adaptive immune system and T cells and B cells and, plasma cells, let me just say that an overactive immune system, an immune system that is over-responding to stimuli, can lead to one or two different kinds of things. If your immune system is overreacting to stimuli within your body, in other words, it's recognizing self as non-self, it's taking the bones, the skin, the tissue, the gut bacteria, the gut lining, and it's saying, "Ooh, this is foreign, we need to react to it." That's an overreactive immune system responding to internal threats, and that leads to primarily autoimmune diseases. And we have over 100 different autoimmune diseases now. We have ones that affect the skin, like eczema and psoriasis. We have the joints, like rheumatoid arthritis. We have the kidneys and skin, lupus. We have the nervous system and musculoskeletal system with MS, multiple sclerosis. We have the GI tract with Crohn's and ulcerative colitis. We have the liver with autoimmune hepatitis. We have many, many, many different autoimmune diseases. Parkinson's disease is a type of an autoimmune disease. Diabetes is a type of autoimmune disease. So things going wrong in the body because of an overactive immune system that is responding to the body's normal tissue, treating it as foreign and trying to destroy it through an immune response. External threats, that would be environmental threats, are primarily manifest with an overactive immune system as allergies, whether it's a food allergy, seasonal allergies, severe allergies to wasp, bee stings, etc., which are very, very common nowadays. I like to point out that when I was in elementary school a long time ago, there was one child in my whole elementary school who had a food allergy. He had a nut allergy. His name was Rohan. He was famous. It was like, there goes Rohan with a peanut allergy. Now these allergies are almost the norm rather than the exception. Autoimmune diseases affect 1 in 4 Americans. They're about 5 to 7% globally, lower rates in less developed countries. So there is something very significant going on why we're seeing this explosion of autoimmune diseases. Why are we all reacting to our own body? Why are we recognizing our body as foreign and mounting an immune response the way we would to an actual foreign body? Like, for example, when pollen gets into your system, you have an allergic reaction to that. It's something foreign in your airway that's supposed to happen. So I want to point out that inflammation, which is the hallmark of most of these autoimmune diseases, is not necessarily always a bad thing. A certain amount of acute inflammation is appropriate. So again, if a foreign body gets into my eye or into my lungs, my body is supposed to mount an immune response to try and protect my body from that foreign agent, whether it's pollen or a virus or a bacteria or whatever it is. But the problem with autoimmune diseases is we see chronic inflammation. We see a state of sort of metaflammation throughout the body. And with autoimmune diseases, it's localized to these particular organs. And so that's a problem. So that's a sort of chronic inflammation. So if we look at the last 30 years, we see this explosion of autoimmune diseases, particularly in more developed countries. Well, what is happening in more developed countries? I'll tell you that the gene pool is not changing in 30 years dramatically, right? Genes do change and evolve, but not over, one generation or even half a generation. So something else is happening. And what's happening is that our food and our environment have changed profoundly. So let's start with the food. If we look at our parents' generation, and I recognize that I'm probably older than many of you, I'm in my mid-50s. So if we look at our parents' generation, I look at my dad, and I also didn't grow up here. My first sort of early years were in Jamaica, but my dad, whose family came from India, grew up on a sugarcane plantation in Jamaica. He grew up running around barefoot. All the food he ate, except for some of the rice, was grown locally by his parents on the farm he grew up on. And he ate no processed food, essentially, other than I think they bought rice and flour to make roti. So he ate a very primarily plant-based, unprocessed diet. And that is true of many of that generation. And that's why there are lower rates of autoimmune disease in that generation compared to our generation and successive generation. That's one of the reasons. So if you look in America, and Dan Buettner, who wrote Blue Zones, has written a lot about this, not just globally out in the world, but also in America. If you look at people in America who are over 65, let's say, the majority of them grew up eating food that was grown locally, that was unprocessed, etc. And then we get into, the TV dinners and the margarine and all of that. We get into sort of a bad 70s food situation. But in childhood, they ate primarily food that was grown on a farm that was unprocessed. And now we have food that is highly processed, ultra processed, made from bioengineered food ingredients. I'm not going to whip up my granola bar it's been sitting in my drawer for 7 years and read the ingredients to you, but you know what I'm talking about. The food they sell in the drugstore, or the gas station, the food that is packaged, is processed, has a long shelf life, and isn't actually food. It's bioengineered food ingredients plus maybe a little bit of food. Like maybe there's peanuts in the granola bar, but there's all kinds of tocopherols and natural flavor and all kinds of other emulsifiers, etc. So that food is very damaging to our gut. It does not feed our microbes properly, and it leads to dysbiosis, to a disrupted microbiome. And it also affects the gut lining. It can increase our intestinal permeability. So when we think about these different, I'm trying to make sure my shirt doesn't pop open. When we think about these different immune responses that we're having, remember that the food, when we eat it and it's in our gut, it's not in our body. It has to get through our gut lining in order to get into our bloodstream and get to different organs. So one of the theories behind some, not all of these autoimmune diseases, is that there's an increase in intestinal permeability in the space between the cells that form that epithelial barrier between what's in your gut, which is outside of your body, and what's in your body, your bloodstream, your internal organs, etc. And that increase in intestinal permeability allows a lot of these toxins, poorly digested food particles, infectious agents, etc., to gain access to your body and to stimulate your immune system. Now, it's important to point out that that is a potential contributing factor to many of these autoimmune diseases, but we can't say autoimmune diseases are caused by a leaky gut. Okay, it's one of multiple contributing factors along with other environmental triggers, dietary triggers, genetic predisposition, etc. But I want to point that out, that the food is very different. It's very corrupted, shall I say, because it is factory food. It's not food mostly from the farm. And if you're trying to figure out, is something processed, should you eat it or not, this is what I recommend you do. You look at that food and you say to yourself, okay, did this come off a tree? Was it dug up out of the ground, off a bush? Was it, caught in the water? Was it living somewhere in a farm-like environment? Or did this come out of a factory? So even simple things like apple, okay, this came off an apple tree. Applesauce, this came out of the factory. lentils. Okay, here's a bag of lentils. I'm going to cook them. These are, dried lentils. They were harvested from the ground. Lentil chips. This is from a factory. And so, the food manufacturers are very clever, and they're giving you these edible food-like substances to make you think that it's food, to make you think that a corn chip is the same as a corn on the cob. It is not. We can make car tires out of corn. Very different product, a corn chip from corn on the cob. If you are going to eat corn chips, the ingredients should be simple. It should say corn, maybe some sort of oil, salt. When you start seeing all the additional things, that is really a problem. So the food is really different and it's sort of corrupted. And also the basic ingredients are highly pesticized. So it may be corn or soy, whatever, it's grown, it's exposed to glyphosate, etc. So the food is a problem. And those of us who have access to it and those of us who can afford it should try and get the best food we can, ideally from the farmer's market. And I realize that's not everybody. And that is a very big problem we have in our society. How can we increase access to better food, less corrupted food? But for those of us who can do it, we should try and save ourselves, and we should definitely be trying to eat as much of that food as possible that is whole, unprocessed food that is grown in a more natural environment, even if it's not organic, but it is grown without the use of pesticides, etc., or harmful pesticides. So that is a major contribution. Now, what about the environment? Well, we know that we are super sanitized and we know we are over medicated. And so we look at medications like antibiotics, acid blockers, non-steroidal anti-inflammatory drugs, the things that we use frequently, not just the antibiotics we take, because we know that about 70 to 80% of the antibiotics being sold in America are used in the animal industry. They're used to fatten up the animals. You get about 15% increased growth of an animal when you feed them antibiotics on a regular basis, or they're used prophylactically to prevent infections in animals who are living in very close quarters and, situations where they're prone to infection. So we are exposed to a lot of antibiotics through our food, even unknowingly. But antibiotics aren't the only thing. We know from a lot of medical studies that have been done. There was an article in the journal Nature in 2018 where they looked at about 41 different classes of medications, and they found that about half of them were disruptive to the microbiome. I recently spoke about laxatives and dementia and the use study from the British Data Bank of over 500,000 patients who found that regular use of laxatives was associated with cognitive changes and a risk for dementia because these drugs were messing up the microbiome. So artificial sweeteners, which I guess is kind of a food, not really, but we think of as foods, more edible food-like substances. So we're exposed to a lot of chemicals in our food, the medications we take, vitamins and supplements. I remind people that all these supplements they're taking that they think are curing things. Believe people when they tell you who they are. So when you read that little label at the bottom of the bottle that says this substance is not intended to treat, cure, etc., any disease, believe them. And also understand that there's no regulation around the supplement industry in the US in the sense that there is no requirement for testing for safety or efficacy. So people can put literally whatever they want in a supplement. They can market it heavily and sell it to you. And many of these substances can actually be damaging your gut microbiome or your gut lining. Okay, so that's an important thing to think about too. When I talk about medications, I'm talking about prescription, over-the-counter, vitamins, mineral supplements. So we have exposure in our GI tract to a lot of these different substances that can be damaging to our gut. And I am a big believer in all disease beginning in the gut, maybe not completely originating there, but as the potential beginning. So when we look at a lot of these autoimmune diseases, the ones that affect the brain, like MS and Parkinson's, the ones that affect musculoskeletal system, our kidneys, our lungs, our heart, our GI tract, we do see disruptions in the microbiome. We see changes in intestinal permeability in many of them. Not necessarily all of them, but that is an important potential trigger. So what I want you to remember is that something that is caused primarily by, or in a major way, by our diet, it is unlikely we can fully reverse that with a pill. Now, in the case of autoimmune diseases, let me be clear and state that immune suppressing drugs like steroids and immune modulating drugs like biologics play an important role in these diseases. I myself have patients whose quality of life has been dramatically improved because of these drugs, who have gone from, 20 bloody bowel movements a day, can't leave the house, to now living normal lives. So these drugs can be life-changing, and I'm very grateful as a physician that we have them. But we also have to acknowledge that these drugs come with a very hefty price tag in terms of side effects. Well, what are the side effects? Well, again, when you have an overactive immune system, which is a basis for these autoimmune diseases, the way you treat it pharmaceutical is you suppress the immune system. And what happens when you suppress the immune system? You now have some other problems. You have an increased risk of infection, and you have an increased risk of cancer, because the immune system is also our body's internal cancer surveillance system. It's going through and looking at all the cells, and anything that's dividing a little funnily, not reproducing properly, it knocks it out. So when you suppress the immune system, you suppress your internal cancer surveillance system, and you suppress your ability to fight infection to varying degrees, depending on the drug. The susceptibility can be more to bacteria, to viruses, to fungal organisms, to parasites, but there is some increased susceptibility. And again, that's going to vary with the degree of immunosuppression. So one of the things to notice is that if we look at these, dozens and dozens of autoimmune diseases, the drugs are kind of the same, right? The biologics you see advertised on TV that look so fantastic, they all carry similar risk of infection and cancer. And the steroids all carry similar risk of increased risk of infection. And so the fact that you can use, one drug for many diseases speaks to a shared root cause of a lot of these diseases. So these are different manifestations of a similar problem. And again, let me not overstate it. I know I'm a gastroenterologist. I love the gut. I think the GI tract is amazing. But I recognize that the contribution of diet and what's going on in the gut is not the only thing. But here's the deal. It's a really good place to start because it's something we can control. Most of us have control over what we put in our bodies. We can read labels. We can choose where we shop, where we get the food from, etc. And again, if you do have the privilege, the financial, the socioeconomic, the time privilege of being able to make those choices, you should exercise it. You should do it because it makes a tremendous difference for your health. So now that I've given you a lot of background, let's dive in a little deeper with some of these dietary regimens. And so again, the goal is we're trying to sort of moderate the immune system to bring down the immune response, not so low that we're immunosuppressed, which would be hard to do with food anyway, but we're trying to sort of bring that down a little bit. So let's talk about sort of general principles first. We know that fiber plays a really important role. Why? Because it feeds a lot of the healthy bacterial species. You've heard me talk about species like F. prosnitzii, Faecalibacterium prosnitzii before. Feeds a lot of those healthy bacterial species that produce short-chain fatty acids. They metabolize the indigestible fiber to short-chain fatty acids as a sort of post-metabolite. And those short-chain fatty acids are really important for modulating the immune system. We've known this for a long time, but we saw this really clearly with COVID, with a landmark study from UMass Amherst that found that high levels of F. prosnitzii, again, these short-chain fatty acid-producing bacteria, were an independent and very accurate predictor of better outcome with COVID. Okay, so we have lots of data showing that that is the case. How do you get high levels of short-chain fatty acids? It's not from a capsule, okay? It's not from a supplement. It is from eating the poorly digestible, indigestible fiber that the bacteria ferment and create short-chain fatty acids, main fuel for the cells lining your gut, and keeps that immune system right where it needs to be. So the first thing is fiber, fiber, fiber. Unprocessed fiber, ideally. Fiber from a box of cereal, factory food fiber, is not the same as fiber from an apple. That's just common sense. You know that, right? You know that. So my rule of thumb is if the food has a label on it telling you how much fiber is in it, yeah, that's not the food you should be eating, okay? The apple has no label. The butternut squash has no label, ideally. Maybe you're getting it cut up from the supermarket. But so whole plant foods that don't have a nutritional label on them, that's what you should be eating. The minute you start to see this nutritional label and, touting like how great this food is and how many grams of fiber and so on, you should kind of have one eyebrow raised, okay? Now, there are some packaged forms of rice and stuff that will have a nutritional label. Okay, I give you that. But once you start to see multiple ingredients and, lots of claims about nutritional superiority, you should be skeptical. So that's the first thing, fiber. There are really two principles when we think about how we treat autoimmune disease with diet. The first principle is what are we going to add? What are you missing that is going to help repair this damage and help restore the function of the immune system and bring it down to an appropriate level? And so this is primarily phytochemicals, P-H-Y-T-O, meaning chemicals from plants. That's why we have this incredible abundance of different plants, right? To feed us and make us healthy. So phytochemicals and different nutrients in plant foods primarily are what we focus on. And when I say plants, it doesn't mean just fruits and vegetables. It's nuts and seeds and legumes, beans, herbs, spices, etc. And we know from my oft-cited study, not my study, but the study that I cite often from the American Gut Project 2018, 30 different plant foods per week is sort of the magic number for a more healthy, robust gut microbiome. So 30 different foods a week of fruits, vegetables, nuts, seeds, herbs, spices, etc. And you've heard me talk about before, you can do a lot with a bowl of oatmeal, with maybe some almond milk, some oats, pumpkin seeds, walnuts, blueberries, shaved coconut, lots of different things, dash of cinnamon, etc. So I want you to think about the variety of different plants. You might be a great plant eater, but you may be eating the same green salad every night at dinner. So think about, throwing in some chickpeas, some raw broccoli, go wild. But think about the variety is very important, the variety of different plant foods you're eating, and also with the whole grains, unprocessed whole grains. Now, different diets for autoimmune diseases, different dietary approaches recommend different things. If you look at something like the Autoimmune protocol, not a diet I generally recommend because it's quite restrictive, but it's an elimination diet. So the idea behind that diet, AIP, is you take out a lot, not just the dairy and the gluten, but you take out legumes, you take out eggs, lots of things. And then you slowly reintroduce foods to see what you're reacting to. The problem with this theory is that most people, it's not sort of an immediate food reaction. It's the sum total of what they're eating that is disrupting things. So they may reintroduce foods and not really notice any sort of reaction to any particular food, but overall the diet is sort of moving them in the wrong direction. So AIP I find super restrictive, and as an elimination diet, at least for my patients with Crohn's and ulcerative colitis, doesn't focus enough on the foods that feed the microbes. So some of those healthy, unprocessed whole grains and other fermentable foods. We have general diets like the Mediterranean diet and the DASH diet, which is a diet for hypertension. And those diets can be helpful for inflammation in general. For my patients with Crohn's and ulcerative colitis, different forms of the specific carbohydrate diet, which was a diet that was popularized in the late 80s by Elaine Gottschall for her child who had ulcerative colitis. It's a sort of first cousin of the paleo diet, but when we have people on it in our population, we modify it a lot. So we take out a lot of the processed carbohydrates, the glutinous grains, the refined sugars. Unlike SCD, which allows dairy, we find our patients do better off dairy. And what we do is we make sure that people are really focusing on getting enough of these high fiber vegetables. Now, if you have active inflammation in your gut specifically, like patients with Crohn's and ulcerative colitis do, it can be challenging to get in all these greens, right? Sometimes that causes people distress. So in our protocol, we have different phases of the diet, a sort of induction phase, which is lower fiber, and then a sort of phase 2, phase 3. We work our way up. And of course, we encourage people to do lots of green smoothies. Just a little plug. I'm launching drug-free IBD, remission without immunosuppression. It's my life's work. It's the course I'm most proud of. And that course launches on Monday, June 5th. And it's a 4-week course. There is a live component with me. And while it's geared for people with Crohn's disease and ulcerative colitis, I dare say anybody struggling with an autoimmune condition could learn a lot from that course. So, check it out. The link will be in my bio on Monday, June 5th. And I hope you'll participate in that course. But let's keep going here. So, the goal of these diets is either to add in foods that people are missing that are restorative for gut health primarily and for the immune system, and then to remove some of the foods that are problematic, that are pro-inflammatory. And so general categories would be obviously processed and ultra-processed foods, processed carbohydrates, fatty meats, so too much animal protein, especially fatty cuts, sugar or refined sugar, or too much sugar. I mean, a little bit of dark chocolate is absolutely fine, but an ice cream sundae every day is not fine. Cake, so common sense about that. A little bit of sugar is absolutely fine for most people, but the problem is people are eating food. They're eating yogurt and baked goods and things like that are very processed, have a lot of added sugar. So too much refined sugar, excess alcohol, and again, looking at foundationally, are these ingredients highly processed? Are they grown from foods that were highly pesticized and exposed to chemicals that are problematic? So it's, again, we want to remove the offending things. We want to replace them with things that are more anti-inflammatory. But what I want to remind you is that no one food is magic. Maybe water is magic, okay? But no, but it's not really a food. No one food is magic. There's no magical acai, fruit, or callaloo, which is where I'm from in Jamaica. I mean, there are nutritious foods, more nutritious foods, and there are less nutritious foods. And if you are a generally healthy person, you can probably tolerate a little bit of processed food, some more sugar than the average person. But if you are somebody struggling with autoimmune disease, you walk a finer line. Then you cross over into this concept of food as medicine, and you have to be more careful about what you eat. So my goal is never to put people in food jail, but it's to guide people to, here are the general categories of foods that are going to be more helpful for healing your inflammation. And here are the things you should generally avoid. You're at your kid's bar mitzvah, you're at your 25th college reunion, go for it. But in general, what are the things that should make up most of your diet? And so it really is sort of, a food as medicine, eat to live approach. It's very common sense. I tell my patients there's really no food that I would tell you absolutely not, except probably soda. Like, just don't drink soda. It's just garbage, poison for your gut. We use it to clean out our scopes when they're clogged, our colonoscopes, to just dissolve through all that stuff. So soda, but here's the thing, soda's not really a food. Okay, soda is just a mixture of different chemicals. And if I took you into a chemistry lab and I set out a bunch of beakers with the ingredients in soda, and I was like, okay, open up, let me put this in your mouth. Or I told you, bring your kid in here, open up, I'm gonna put the stuff in them. You would be like, don't do that. So don't do that when it comes to soda is what I want to remind you. But there's no food that is so terrible that you have a bite of it or a serving of it and it's like, okay, it's all over. Now, granted, if you have celiac disease, then yes, you cannot eat anything with gluten, not a bite, not a picogram if you have celiac disease. But let's say you have an autoimmune disease. It is not like this one food is magic and it's going to make you better, and this one food is terrible and it's going to, kill you. So I want you to have a sort of healthy appreciation for the power of food to heal and the power of food to hinder, and understand that it's a sum total of what you're eating that is going to get you to the finish line, one way or the other, depending, again, are you healthy? Do you have autoimmune disease? The other thing I want to encourage you to do is to explore. Now, when you're exploring and it involves buying a lot of supplements, don't explore that. But if you are exploring somebody who, seems to have some good advice, try it. What's the worst thing that can happen? Let me give you an example, and a little shout out here. Brooke Goldner is a psychiatrist who was diagnosed with lupus at around 16. And her first book was called Goodbye Lupus. And I met Brooke and her husband, lovely couple, at a conference. I believe it was a plantation conference in California several years ago. We were both speaking. And that's when I first heard her story about overcoming her lupus nephritis. So lupus had affected the kidneys and it was quite advanced, with her plant-based diet, high degree raw. So she wrote that book, Goodbye Lupus. And then she came out with another book recently called Goodbye Autoimmune Disease. It is a very, very, very restrictive diet. But here's where there's some similarities with what we recommend. She really stresses the green smoothies. And I really stress the green smoothies for my patients. Why? Because we see remarkable results. When we mix up this blender full of leafy greens and high fiber vegetables, a little fruit for flavor, and other things you need to make it taste good, and we get patients drinking a lot of that, we notice dramatic results. In fact, I feel like and I've seen it, we can heal so much of what's gone wrong in the gut with using things like green smoothies and other very nutritious soups, etc. So Brooke's program is, again, very restrictive. It's a lot of green smoothie, even more than I'm drinking. I'm often drinking 40 ounces and hers is even more. And it's, she removes a lot of food. It's a high raw, but it's also for people who are really sick. So if you have, advanced lupus or severe MS or something, that's something that is probably worth trying, right? Like, what's the worst thing that can happen? And the thing I love is she's not selling you supplements. Okay, what about who else? So my friend Terry Walls, another physician. Terry's a rheumatologist by training. She herself had MS and went from being wheelchair bound to now riding her bike. Terry and I have the same publishing team at Penguin Random House. I've met her at conferences, etc. I consider her a friend and a colleague. And again, she's doing amazing work in the MS space. They call themselves Walls Warriors. And it's, what is the worst thing that can happen by changing your diet and cutting out the crap, okay? Like, even if your disease doesn't go into remission. And so, Terry's diet and my diet that I recommend for Crohn's and ulcerative colitis vary, and it vary based on clinical experience. Terry, like me, has been a doctor a really long time. She's treated a lot of patients. This is what she's found through scientific study, clinical observation, trial and error. This is what works for her MS patients. There's a little more organ meat and it's a little more animal protein heavy than what works for my Crohn's and ulcerative colitis patients in general. But she's a trusted clinician with a lot of experience who's not trying to sell you some magic potion. She's trying to sell you really good advice. So, when I say experiment, folks like this who, and again, it doesn't have to be a doctor who had an autoimmune disease, okay? These are just examples of two doctors in the space who I think are doing great work and also happen to be people who had serious autoimmune disease. But it's good information. I think it's trustworthy, good information. And I see people out there selling autoimmune products that are bars and protein shakes and supplements, many of which have made my patients sick. And I'm not going to name names because I don't want to take down anybody. But all I want to say is that when somebody is heavily pushing the products rather than a way of eating and a lifestyle and talking to you about, ways you can manage your stress that don't involve a pill, and the importance of exercise and being outside and healthy food, when it's very product heavy, you should have one eyebrow raised and you should, think, really, is the pill really going to just solve all of those problems? And be skeptical. But explore, because I'll tell you, even within my IBD patient, what works for one patient with Crohn's doesn't always work for somebody else. Some people tolerate a lot of unprocessed whole grains and are having oatmeal and brown rice and quinoa and doing great. And I have other patients who don't tolerate the grains as well and eat in a more sort of paleo type way with fewer whole grains. And that's what works for them. So the other thing that I would suggest that you do is try and find a healthcare provider who believes in a food as medicine approach, even if they themselves don't know a lot, but somebody who's willing to say, okay, that sounds interesting. That's a pretty healthy diet. Let's see how you do. Not somebody who's going to immediately be like, oh yeah, food doesn't make a difference. If you have an autoimmune disease and your doctor tells you that what you eat makes no difference, you know what to do. Get looking. Now, they may be a fantastic doctor in other ways. They may be the world's expert on the biologic they're prescribing. So you may not want to get rid of them entirely, but you need to find somebody else to be in your corner who is going to be an advocate for you in trying to pursue diet, lifestyle, etc. So I'm not saying fire your doctor if they don't believe in food as medicine, but get somebody else along to advise you, okay? Some of my colleagues at Georgetown, many of them, they're doctors I trained because I've been around a little while. Many of them don't believe in a food as medicine approach. And guess what? They're fabulous doctors. I send patients to them. But I tell my patients, look, I'm sending you to this doctor. He or she is great. You need to be on this drug. They're going to do a great job with your colonoscopy, etc. But the diet stuff, they're not going to be able to help you with. So, we'll continue to do that, or here are some resources for you, etc. So not every doctor is going to be everything to you. You might not find everything you need in one doctor, but try and build a team, build resources, even if it's somebody like Brooke Goldner or Terry Walls or me, where we're not personally taking care of you, but somebody who you trust, who you feel like, okay, this person's giving me good advice and they are vested in my health and they're not just trying to commercially take advantage of me with a supplement. So that's what I mean by explore and building a team and all of that. We have access to lots of information on the internet. It's not all great. So, one eyebrow raised for some of it, especially when people start with the selling piece of the products. But, there are also resources. You can look at published papers. If you are researching something, make sure you're looking at a peer-reviewed paper and not just something on somebody's website that's marketed as research. Okay, I've been chatting a lot and I have to end a little bit early today, so let's take some questions. Okay, that's why I'm talking fast. All right, let us see what we have. Hello, 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 everybody. Okay, what do I think about colostrum supplements for colitis? I have not seen any clinical scientific evidence that colostrum supplements help with colitis. That doesn't mean they don't, but what I'm telling you as a physician scientist who's pretty familiar with the literature, I've not seen any compelling evidence. And again, I want to remind you, it can say colostrum supplement on the box. You actually have no idea what is in that. All right. Am I doing GI mapping of stool studies? So the GI map is a particular test looking at stool. I am not. Why? Because a lot of the things they report in the GI map test as abnormal that get people all worried are not things that are clinically validated and useful. And as far as a microbiome analysis they do, it's not particularly good, the technique they use. So I don't find that to be a particularly useful test. I do other testing. There are times when I'd recommend people do microbiome testing. I send stool to a lab called Parasitology Center International, Incorporated PCI in Arizona for parasite testing. I will check some of the things that the GI map test purports to do, but generally from other labs that I find more reliable. And again, I look at a lot of GI map studies because a lot of the people who come to see me have had that testing done, usually by a functional medicine doctor, but I don't find it to be helpful. Okay. Let's see what else we have. These have been great questions. Oh, Juanita says, I have MS, and this is so true. Juanita, I'm wishing you like all the best in your MS journey. That can be such a tough disease. But, you know, the data that we have on MS now is so interesting. First of all, the viral etiology in a lot of people and, you know, the associations with diet and so on. So I love Terry Walls. I think she does great work. So I highly recommend her courses, etc. Okay. Oh, faithful studies. I'm so glad you asked this. Do substances like xanthan gum affect the gut? Yes, yes, and yes. So emulsifiers, gums, things like that. So carrageenan, xanthan gum, soy lecithin, etc., have been found to directly affect the gut and be a contributor to Crohn's disease. So very, very important. And if you're not eating ultra-processed foods, you're not eating xanthan gum. So if you avoid those foods with the labels, you don't even have to look for it, right? So thank you so much for pointing that out specifically. JD, I just have to give a shout out to my friend JD, if that is who I think it is, who has the best handstands in yoga. And I always try when I go into yoga to not be like, oh, look at them, look what they can do. But JD is pretty amazing when it comes to his handstand game. Okay. Hi, plant-based addict. No, you're a legend. Okay. And here's the thing, right? I love plant-based addict. If you don't follow him, you absolutely should. So this story of overcoming addiction and obesity and depression and hopelessness and virtual death through food is just so beautiful. And knowing him as a person, I mean, it is, talk about inspiration, right? So, and again, just selling the idea of eating healthier, eat more plants, you know, not like, oh, here's a magic pill and it's full of plants and just swallow it, right? So definitely, like, you know, these are the folks we should be paying attention to. Okay, what else we have? It's just like a big love fest here. Chris wants to know, how can I set up an appointment with you? You can go to robinchutkan.com under About or Medical Practice, or somewhere on the tab there, you see the information, and I would love to see you. Okay. One of the things I want to point out too, and let me just preface this by saying that my mother is named after Lenin's wife. Her name is Krupskaya. Why? Because my grandfather on my mom's side was a communist. He was a card-carrying member of the Communist Party, but he was also involved in the fight for independence for Jamaica, and he was a trade unionist and other good things. And I always say Grandpa Frank would be turning in his grave to see that I don't take insurance and I charge people, etc. But part of why I do that is because I'm not doing colonoscopy all day long. I'm making a lot more money doing that so that I can sit with people and spend, 75 minutes, 90 minutes, however much time they need. And from an insurance point of view, that time is not valued. It's not reimbursed really appropriately for a gastroenterologist. But I feel badly about that. And so I do try and provide as many free resources as I can, office hours, guides on the website, blogs, books, etc. And the courses, because the courses are a way for us to pack so much information into something that is scalable and evergreen and much more accessible cost-wise. And I'm kind of having this push-pull with Olivia, who's our wonderful head of digital operations and a registered dietitian, because she's like, this is way too much information. And I'm like, no. I want to, under-promise and over-deliver. I want people in these courses to get everything they need to understand. I want all the scientific studies in there. I want all the descriptions. They don't have to read it. They can skip over it. They don't have to watch every video with me or listen to every audio recording. But I want to give you as complete an education and foundation in this stuff as I can so that you are in a good position to make a good informed decision about this, right? So knowledge is power. So there we go. Okay. What about if you are intolerant to fructose? So if you're intolerant to fructose, remember the things that have a lot of added fructose. So the drinks and the cereals and the bars and so on. And yes, is there fructose in fruit? Yes. But when you cut out all the processed fructose, you probably have room on your plate for some of the naturally occurring fructose. And most people, it's not that we're really intolerant to fructose. It's that we're eating more fructose than our bodies can really handle and can metabolize. So get rid of all the fructose in the processed food first. Hi, what was the name of the first doctor? So that was Brooke Goldner, Goldner, and she's sort of the lupus person. And it's so interesting because I'm a conventionally trained doctor and I hang out with both. I have my groovy sort of integrative medicine friends and I have my very conventional medical friends, and I'm non-denominational. If you're a good doc and a good person, I'm your friend. But the conversations are really interesting because my conventional doctors are like, oh, that Brooke Goldner, she's a total quack. And I'm like, really? Because she's just telling people to eat a lot of plants. Like, I don't find that to be quackish. And she's actually in her book presenting evidence of, stories, like real actual stories from patients. And guess what? She's not trying to sell you a bunch of nonsense supplements. So I'm like, okay, this might not work for everyone, but I don't see that as dangerous. Okay. What I do see as dangerous is only recommending a drug with serious side effects and completely dismissing the idea that what you eat and how you live could actually be contributing to your disease. I think that's dangerous. Okay. What else do we have? Eating soluble fiber before insoluble to help with ease of fiber intake. I don't think it matters. And remember, most foods are a mixture. If you look at most fruits, for example, they're a mixture of soluble and insoluble. So I don't think we have to be as detail oriented as that. Okay, what about processed health foods like Beyond Meats? All chemicals, too many chemicals. I mean, once in a while, sure, but that stuff cannot be a regular part of your diet. Way too many chemicals. Okay. Nature and their supplements. Again, not something that I find useful. It's so interesting. Everybody wants to know, like I say, okay, supplements really haven't been shown to play a role, and then everybody's like, what about this supplement? What about that supplement? We have all been really indoctrinated into thinking that these supplements, which are really just unregulated, untested drugs, are, the answer. Okay. What are my thoughts on farm fresh eggs to accompany a largely plant-based diet? I think that's absolutely fine. Absolutely fine. Now, let me say that there are environmental and ethical and sort of climate-related reasons to eat one way or the other. But if you're asking me as a physician, as a gastroenterologist, do I think there's room on the plate from a health point of view for farm fresh eggs? My answer is yes. Okay, Hashimoto's effects on the gut microbiome and weight gain in postmenopausal women. What about that? And then what are my thoughts on akkermansia? So let's start with the akkermansia first. That's a gut bacteria. Akkermansia, one of the bacteria that live in the gut, not magic by any stretch of the imagination. Any evidence that taking an Akkermansia probiotic is going to make a difference in your gut? No evidence. What we have are observational studies that people with this have more or less of that. But we don't have studies showing that you give an Akkermansia supplement and you heal anything. Okay, we have association studies. What we have is evidence that if you eat in a certain way to increase the species like Faecalibacterium prausnitzii, like Akkermansia muciniphila, that is a healthier way of eating, but not direct evidence for using an Akkermansia probiotic product. So I want to be clear on that. Hashimoto's on the gut microbiome and weight gain in postmenopausal woman, way too, just a whole other, 2-hour-long office hours, but I am due to do another office hours on menopause. So coming up with that. Okay. Hormones and the gut. Yes, coming up with that. These are great topics to do. I'm going to have to stop in about 2 minutes. So let me answer this really great question. Does it seem to be universally true that those with autoimmune should avoid gluten regardless of the autoimmune condition? So what I want to tell you, a lot of our opinion in the sort of integrative GI world around gluten is formed really by two things. In my case, it's formed by experience and observation. So I've been a gastroenterologist a long time. I finished med school in 1991. And I have seen in my career as a gastroenterologist, thousands of patients with autoimmune disease, thousands. And even if we don't just look at the autoimmune diseases, even if we look at other GI conditions like diverticulosis, constipation, etc., what I have found clinically is that when we can remove most of the gluten, if you don't have celiac disease, you don't have to remove all of the gluten, but when we can get, let's say, remove 80% of the gluten, people feel better. People feel better symptomatically. What some of the data has shown us, Al Fasano, who's a pediatric gastroenterologist originally from Italy, who has done a lot of the studies with gluten, what he has shown is that gluten increases intestinal permeability. We see increased levels of a protein called zonulin in the blood, a marker of increased intestinal permeability, and that is a way that damage to the gut is mediated. So based on his research suggests that none of us should be eating processed glutinous products, the baked goods, the pancakes, the cookies, the waffles, etc. Do we need a scientific study to tell us that the pancakes, the cookies, the waffles, etc. shouldn't be a mainstay in our diet? We don't, right? These are processed factory foods. It's obvious, it's common sense. Your grandmother could tell you that whether or not she has a medical degree. So if you don't have an autoimmune disease and you like celiac disease, you can eat a little gluten occasionally, but it shouldn't be a regular part of your diet because it's a factory food. If you have an autoimmune disease, what I find with my patients with Crohn's and ulcerative colitis who don't just have autoimmune diseases, they have autoimmune gut-based diseases, is that taking out the gluten helps tremendously. Now, there's varying degrees of tolerance. Some of my patients can eat, 80% gluten-free and they're fine. Others have to be 90% gluten-free. Others 50% gluten-free. And I always advise against substituting gluten with the gluten-free pancake, the gluten-free cookie, the gluten-free waffle. That's a total waste of time. That's just swapping, one processed carbohydrate for another. So that's my sort of long-winded answer. Okay, you guys, you just have so many great questions that I don't even know what to do. I could stand here with you all day, but I have to dash because I'll just tell you, my daughter's graduating from high school and there's this thing called Senior Celebration, which is a show that the parents put on to make fools of ourselves and entertain the kids. And it's this Saturday. And in her 14 years at the school, I have volunteered very little. I've done very little on the PA committee. I've used the excuse of I'm a busy working mom, but I've sprung into action for Senior Celebration. And I'm sort of, planning committee, running a lot of the show. So we have a rehearsal tonight and I got to cook dinner before the rehearsal and I got to work out before the rehearsal. So I have very important reasons to go. But here's what I'm going to do. In a couple of weeks, I'm going to be launching the Gut Bliss podcast, which is a longer format for each of these topics that we can really dive into. And then we're going to use office hours for the after the show questions. So here's how it would work. Like when the podcast drops, let's say the podcast drops on a Wednesday. and the podcast was on diet and autoimmune disease. And I'm able to spend, 45 minutes in a really organized way going into these things. Then the following week on office hours, I can shut my mouth. I don't have to go into all of this. And that time would be used just for you guys to ask questions. Now, the goal, of course, would be to listen to the podcast, right? But I think that is going to be a better format, because by the time I finish talking, it just doesn't leave enough time for the questions. So more information on that to come. Always so great to be with you guys. And do check out Drug-Free IBD, Remission Without Immunosuppression, when it drops next Monday. All right, take care.